Okay, everyone. Thank you very much for joining in for this HelloNote 2.0 webinar. My name is Steve Gluck. I'm an occupational therapist and I am the CEO of HelloNote. So the goal of this meeting today, of this webinar, is to show everyone the capabilities of HelloNote 2.0, what changes to expect, and new features. And also we had a Q&A option during registering for this webinar. So I definitely want to go over those questions. So there were about, there's about 40 questions that we had. So I want to get through them all. So I'll begin by going over a little bit about HelloNote 2.0, what to expect during the migration. If you are already migrated, you don't have to worry about migration anymore. You're just going to get updates on new features. Even looking at the screen today, we actually had new updates today on July 11th. So we are pushing updates weekly. There's a lot of new updates, new enhancements, new features that we are updating. A lot of them are being held back because we want to make sure that all of our users are migrated before a lot of new features and integrations come out. So if I would have to put a percentage on how many clients are already migrated, I would say we're about between 30 and 40%. The good news, though, is that we're ramping up migration over the next few months. So we started the migration around July of 2023. So now we're in July 2024. We learned a lot. We're grateful for all the feedback that we got from the early adopters of 2.0. Of course, there were some negative feedback that we had to address, and we love, of course, the positive feedback, and we're all about feedback. So those that have been with us from the beginning, you know that a lot of our system is built based on feedback. So none of your feedback that you give us gets brushed under the rug. We make sure that we put it on our engineering team board, and then we see which updates are priority. And based on priority, we push them first. And priority means just how many clients request this feature. So definitely don't be shy. If you have a feature request, or it could be a simple report, just let us know, because it does not get brushed under the rug. We want to make sure that we update our system. We don't want to be stale, and we want to always strive to improve HelloNote and make sure that we can scale with you guys and any future clients that we have. So the first thing I want to mention, of course, is our team. Our team has been working really hard to get HelloNote 2.0 up and running, from the engineering team to the support team, enrollment team, onboarding, the demos. All of that is a collaborative effort. So I do want to say a special thanks to all of our team who made this possible. And we are growing. So that means we're adding new team members to support a lot more clients and a lot more users that you guys have. Of course, with more features, we also need more support team to make sure that everyone knows how to use everything. So we're actually developing a new knowledge base. So it's going to consist of videos and tutorials on new features. Because one of the challenges with EMRs is there's so much in there. There's so many features, and almost on a daily basis, we get a request for a feature or a how-to question, and we tell clients, oh, we have that already, and they had no idea. So we're going to try to do a lot more webinars. We're going to hold monthly webinars, but we need questions. We encourage you to reach out to us. You can email hello@hellonote.com. Just let us know you have a feature request, you have a question that you want to hear on the webinar, and we'll get to it. So we definitely want to, the system is for you guys. So we want to grow with you, and we want to be the best system we can be. So first thing, actually, I want to go to is the URL for the migration steps. So a lot of the questions we get for users that are not yet migrated, which is around 60 to 70% of everyone currently, is what are the differences, like what to expect during the migration. So in this URL here, it's going to have a little video on how to log in for the first time, how to update your user settings, patient action buttons, which are a little bit different, adding new patients, which there's a new button for that, some scheduling updates, and of course, an FAQ. So I do want to go over the FAQ. So first part of the FAQ is, will the system be down during the migration? So we don't want to take the system down, right? So especially during Monday to Friday, which is when majority of everyone is using the system. So what we're doing is we're doing the migration over the weekend, okay, as to the best that we can. So expect the system to be down from around 10 p.m. Eastern to Monday 8 a.m. It could be. It doesn't mean that the system will be down the whole time for you. It just means that please just make sure to make accommodations not to log in during that time, because the migration is really delicate, right? And we have to make sure our engineers do what they do best, is to make sure all the technical aspects are handled. And if they find an issue, they have to restart the migration, because we don't want you to have any data loss, right? And that comes into our next question. Will my data be automatically carried over from HelloNote 1.0 to 2.0? So yes, your data will be automatically transferred from 1.0 to 2.0. So that includes notes, schedules, invoices, all the documents you uploaded, pretty much everything, right? Your user accounts, all of that will be migrated. So even though it's migrated, we do ask, if you notice something, just let us know. Maybe there's a schedule that wasn't updated or something like that. Let us know, because we still have access to 1.0. So none of your data is lost or anything. We have a lot of steps and measures we take to ensure everything transferred over. But technology is technology, so we do ask for your feedback. Just make sure everything looks good. And majority of the time, everything looks good. There were a handful of times where we did have to remigrate some data, and we usually do that. That's an urgent priority for us, so we take care of that. So next question is, how do I log in to the new system? So if you have a bookmarked or favorite URL for the HelloNote 1.0 version, please make sure you either delete or update that URL. And the reason is because that old URL will no longer work. It will work, but your office is going to say inactive. Okay. So we have a new URL. This is it. There's also a shortcut to this one called v2.hellonote.com. So, and you don't have to really remember it. On the top, when you go to hellonote.com, on the top, there is a tab that says login. So if you click login, it will take you to select your EMR version. So you can either click login to 1.0 or login to 2, and make sure you bookmark it. Okay. So once again, if you bookmarked the HelloNote 1.0 URL, make sure you update that and bookmark the new one, because it is a different URL. So with that being said, your username and password will be the same. So you're actually going to have to log in with your old username password one time, and then it's going to ask you to update your password. Okay, so just keep that in mind, and that is done one time. You don't have to keep doing that. So next, does HelloNote 2.0 look different than 1.0? So yes, there's significant changes in 2.0 as far as the user experience goes, including a new user interface. With that being said, we kept a lot of the functionality and the buttons and the layout very similar. So after migrating about 30 to 40% of clients, we did not get any feedback where somebody was lost. Okay, nobody has ever said, "Oh, I can't find something that I knew how to do in 1.0." So we're very confident that you're not going to get lost in 2.0. Just make sure you orient yourself with the new interface, and once you do, then all the navigation tabs and things like that are going to be similar. Okay, but yeah, I would say take an hour or a couple hours just to kind of navigate, play around with the system, just from a perspective of navigation, because it will look different. But the goal, of course, is to streamline and make sure that we're scalable and not just stuck in, one office. Because, throughout the 10 years or so that we've been since our inception, we had so many of our clients grow to where they need multiple locations, or they became a hybrid practice doing mobile and brick and mortar. And we want to be here to support everyone. So in order for us to do that, we had to grow into HelloNote 2.0, which comes with its own new features and components. So next is, will I lose any features? So you shouldn't lose any features, especially now. We pretty much caught up with a lot of features that were on 1.0 to get them onto 2.0. If you were an early adopter, then yes, there might have been features that are not yet ready. It's not like we removed them. It's more of just making sure that we properly migrate those features to 2.0. So as of now, we're doing pretty well as far as getting all the features ready to 2.0. So it shouldn't be a problem anymore. But the benefits outweigh the negatives. So there's faster loading times, newer features, of course. So some features or reports, not a lot, and we did take a survey to make sure that we don't have any missing features. So either way, over the next few months, we plan to finish the migration, which includes bringing all features from 1.0, no matter how small they are, to 2.0. So will I need to reconfigure any features? So the only thing we're asking for reconfiguration is appointment reminders for patients. Okay, so if you have SMS and email reminders set up, because we are not the ones actually sending, we're an EMR, we're not the ones sending the SMS and email reminders. We have a vendor for that. So because of that integration we do ask to just reset those. Okay, so, and that's not always the case because we do have clients that migrated and everything is working fine. So our engineers did work really hard to make sure that you don't have to reset anything. But just as a heads up, so maybe the appointment reminders just need to be reset. Is there an increase in pricing? So 2.0 is not optional. So again, our goal of 2.0 is to make sure that we grow as an EMR and we help our clients scale. So no, there is not going to be a price increase because it just wouldn't be fair to increase the price to a system that you're going to have to upgrade to. Okay, so overall, I mean, for 10 years, we did not increase our pricing at all. So we're making sure that pricing is affordable to everyone. We don't care of the size of your business. We treat you the same. So we're going to continue on that path. Listen, our vendors do increase prices, right? Just like your business has costs that go up, whether it's rent or utilities or other softwares that you have to pay for. So, in general, costs are always rising. So we're doing our best to not increase prices. So for 2.0 upgrading, there's no added cost. Can I go back to HelloNote 1.0? So no, the migration is one way. So once we migrate you from 1.0 to 2.0, you cannot go back. Even though we have the data on 1.0 still, we're not going to allow anyone to go back to 1.0 because that just will create a mess of migration. So again, our engineers are making sure things are smoothly running, and they told us we cannot go back and forth. And we listen to our engineers because they are important to us. They know what they're doing, and essentially they're the pilots. So we want to make sure that we listen to them. So you cannot go back to 1.0. So if you want to migrate to 2.0, you can let us know. If you decide that you want to hold off a little bit, no problem, let us know. But just so everyone's aware, over the next few months, we're probably going to send an email to everyone and give you a date for migration if you have not reached out yet. Okay, the faster we migrate everyone, the better it is for everyone because we have a ton of new features and optimizations that we want to launch. And unfortunately, we can't launch them when we don't have everyone migrated. And then the last question here is, what if I have any issues? So if you have any issues, as always, just reach out to us. We're always happy to help. We have extra support as well. So we got new team members. So we want to ensure that you guys trust us just like we trust you to make sure that we meet your practice management and billing needs. So please reach out to us, have an open line of communication, and we'll make sure we do our best for you. And we listen to the community and make sure that we update our system to be the best EMR that we can be. So that gives a little bit of an FAQ of what to expect. So I do want to go over now a few features. I'm going to close that tab. A few features on 2.0 that are different. So we do have other videos that we uploaded on a walkthrough of 2.0. So I definitely encourage everyone, if you haven't yet, to watch it. If you're still on 1.0, this way I kind of go over every component of the system. For this webinar, I'm not going to go over every component. I just want to go over any kind of specific changes, because one of the most common questions we had on our Q&A is to showcase like what new features are out on 2.0 and how it's going to streamline your practice, which is our goal. Our goal is to make sure that your practice is streamlined. If you're a therapist, we want to make sure documentation is streamlined. If you are a practice owner, whether you're a therapist or not, so we want to make sure that you have all the tools in the system to make sure that you don't, spend more time than you have to. So first thing I want to go over is the dashboard. So the dashboard here, you'll notice it looks a little bit different. And as I mentioned, on the right side is what's new. So these are feature updates that we have. And even today we have new features. So I highly recommend you just look here. And you can always skip the dashboard, by the way. We do have a setting for that. So if you don't need the dashboard, you want to go straight to patient information section, you can. But I like the dashboard just to give an overview of what's going on. Scrolling down, you'll see there's a lot of similar reports that we always had. One thing that's new here, I like to mention, and you'll notice this in a lot of reports, you'll see here that the case is in blue. And the reason it's in blue is because it's actually going to link you to open a new tab directly to this chart. So for example, if I click on it, you'll see it opens up a new tab and brings me right into the tab, into the chart. Okay, so no more needing to kind of lose where you are and open up new tabs and things like that. With that being said, if you look on the top navigation menu, one of the buttons is actually called duplicate current page. So wherever you are and you don't want to lose, you don't want to lose this specific tab that you're on, you can always click duplicate current page and it's going to duplicate it for you. And now I can navigate to patients or wherever I want to be without losing where I was before. So I do recommend using that. So also on the top, just quickly to mention, we do have a new notification feature with a bell. And you'll notice it says 4 there. So that means I have 4 new notifications. If I click on it, it gives me little updates of what happened. In this case, I have some fax updates. And I can set all of these as red. I can see all notifications and so on. So think of it like like in social media, you have a little, a little bell that says how many notifications. So same thing. And we're going to be adding more and more kind of events here. So this way, and you can toggle which events you want to know about and which ones you don't. So if you don't care about faxes, for example, you can turn those off, but you care about if a case was discharged, you can enable that. Also, one thing I do want to mention, it's not up and running yet, but we actually have a new placeholder here for KPI. So I'm big on KPIs, and so KPIs, just so everyone's aware, is so it's statistics and making sure that your business is running properly. Okay, so one of the things I like to run on my end is just Excel tracking of what's important for our business. So KPIs is called Key Performance Indicators, and I actually have a webinar I recorded on that before, so you can listen to that. But yeah, so instead of having to run individual reports, we're going to be putting a lot of KPIs directly on your dashboard. So just by looking at your dashboard, you'll be able to see, how many evals were done by OT, how many evals were PT, how many cancellations did you have over the week, and so on. So that's going to be a really big game changer, I know, for a lot of you, because I know a lot of you do that manually, and then I know a lot of you don't even run those. So this will allow you to have that right on your fingertips. So that's something I look forward to. And this should be out by next month. So I'm looking forward to that. So So next is we have a clock in, clock out. So again, I know we have that in 1.0, but I want to make sure everyone knows about it because it's something we actually get asked a lot about. Do we have the ability to keep track of when therapists or staff members clock in, clock out? So just to show you how it works, I press clock in. It says, are you sure? Press yes. And now you'll notice the clock turned green. And if I put my mouse over it, it starts counting. Okay, and that's it. And I could just go about, whatever I need to do, and until I clock out or log out, which will automatically clock me out. So now let's go to the left sidebar. So again, with 2.0, the left sidebar is going to have your main navigation. So I'm going to click on Patients. And from the patient perspective, so this is going to look similar for a lot of you, but again, I recommend just playing around with it because there are a few differences in here. So the patient list is similar. So I'm going to click on a random patient, and you'll notice I have a patient alert. So this patient alert actually comes from here. Okay, so you can put whatever you want in here, and it's going to pop up for everyone to be aware of something like that. In this example, it's an authorization. So this way, therapists and staff members that are looking at this chart know, some billing rules for this patient. And if I click another patient, it doesn't appear. So this way, it's per patient. And then you can, of course, drag it around if you want to. If you want to kind of out of view, you can do that. Or if you want to close it, you can do that as well. And if you want to bring it back, there is this red indicator with the letter I. Click on it, it comes back. So next, so one of the other things I really like to show everyone, because we still get a lot of clients that tell us they use their phone for reminders or a notepad or Excel. So we actually have an event tracker per patient here. So it's the last action button, so right before edit. So I can click on it. I could set any event type that I want, set a status, set a reminder. I can add other users to it. I can select a case and then save. And then the system will alert you when it's due. We also have the option to email you every morning with all the reminders that are due. So definitely use this. And, I highly recommend keeping everything within the system because, the more you can keep within HelloNote, the more organization and time you'll have because you don't have to go use another platform or your phone to keep track of things. And it's HIPAA compliant. So that's also a big bonus. So next, I do want to show the insurance tab. So with insurances, we're always getting feedback and making sure that we're up to date on insurance guidelines and rules. So private insurances are getting trickier. Not only private, it's also like Medicaid plans. So a lot of them are actually attaching not only authorizations, which of course we have here, but also like specific CPT codes with how many units you can bill maximum. So we do have CPT rules set up here. So let's say it's an insurance that limits you to a specific code. So I'm just going to select the treatment, whatever I want here. 10 units is 97535. I'll save it, and now it's saved. So that means when therapists are doing notes, once they exceed 10, it's going to prevent them from finalizing. So similar to authorizations, where it's per visit, but some insurances are now applying per unit of CPT code. So we're always trying to be up to date and catch up to those rules to make sure that you get paid and you don't go over, because insurances are not lenient. So if you go over and you didn't know about it, you bill, you're going to get a denial. They're not going to pay you for it. And from my experience, they're not going to, make any accommodations for you. So next thing to go over is the payments tab. So one of the things we added to 2.0 is the ability to add a credit card profile to a patient. So what this means is that you can save credit cards for your patients here for future reference. So if you have a patient that comes in one of the things, especially if you're like cash-based, you may want to ask them for a credit card. You could also put it in the intake consent forms and save it here. So this way, maybe you don't need it now, but as time goes on, maybe there's a co-payment or co-insurance that you need to collect. You can actually run the card that you saved. So this is something that we did not have in 1.0, but we have it in 2.0. So next tab is the visits and receipts tab. So visits and receipt tab, we tried to keep similar, but there are a few improvements here. One of the improvements we have here is when you print. So if you remember on 1.0, you have the option to print the full receipt and invoice, which includes what the insurance paid and kind of all those other details. But now we have an option for patient receipt and invoice. And the reason this is important is because a lot of patients get confused when you send them a bill for just a copayment, and then they see something like write-off and adjustment, billed amount. So they don't really care about that, but they're going to get freaked out about it because there's a lot of numbers on it. So if I print just the receipt for the patient, you'll see here it just clearly has the charge amount, the patient payment, any extra service, and the balance. So if they just owe you a copayment or it's a private pay visit, you'll have that. Also, you can add a QR code on the bottom, which is linked to our credit card processing vendor, and patients can just scan the QR code and make a payment, which is pretty convenient. So next is going to be the Notes tab. So as far as Notes tab, we tried to keep things very similar. We did add little icons here. So if you remember on 1.0, it was just a green check to say that the case is active, or a red X to say it's inactive. So now we actually added case type here. So you can see if there's any case types or authorizations. There's different icons now without actually going into the case settings. So from here, I do want to showcase one big feature, the great feedback that we had. So when you press add, for example, you're adding a case. So you're going to see there's a lot more options here. So let's say, for example, there's a specific insurance, and you know that they require certain settings. So if I add, for example, let's say AARP, notice it's going to ask me if I want to preload case settings for AARP. So once I press yes, you'll see it's going to update my profile. It's going to select a case type for me. And if I scroll down, there's different note rules and billing rules that I can apply, which is really nice. So this way, because a lot of insurances have specific rules, and if you have a lot of cases with that, you're going to have to remember, oh, this one requires time in, time out. This one requires a progress note at the, between 5th and 8th visit, and so on. So this way you can preload it. Also, you'll notice that there's a section for adding past medical, surgical, and diagnosis here. So if patient fills out like an intake form, they may already have this information there. So no need to wait for the evaluation note. Maybe you can preload this, and then when the therapist loads the note, it's going to preload that data for them. So this is a nice enhancement to streamline documentation. Then we have Documents tab, which is very similar, signature and telehealth, of course. No major changes there from 2.0, not yet at least. We do have some enhancement plans, but not yet. One thing I didn't mention back to the Information tab. So I know a lot of you are using it, but just want to make sure everyone's aware. You can send intake and consent forms directly from here. We are going to be allowing everyone to customize their own intake consent forms shortly. I hope I want to say maybe a month and a half away from releasing it. In the meantime, send it to us. We will customize it for you. But after a month and a half or so, we're actually going to allow you to customize it yourself, and it's going to pull that data right into the patient chart. So, which is going to be awesome. So I'm also highly looking forward to that, and I know a lot of you are as well. All right, so we went over the patients. So from the schedule, so if you know on 1.0, the scheduling was lacking some features, including the speed. So in 2.0, it's really quick. You can also update the interval. So right now it's at 10 minutes. I could do 15, 30, or 60. So if I do 30, it reformats it for me. I can drag things around, do whatever I need to do. It also tells me how many visits in parentheses for this therapist if I have multiple. I can reorder therapist, which is nice here. So there's ordering. There's also static events here that are better than 1.0. And the reason is because when I click on a visit, I can actually choose the color of the static event now. And we're going to be also releasing categories for static events. So you can have like preloaded categories without having to type a description. But if you want to type it, of course, that's no issue. All right, so we will be launching a Google Map integration as well, hopefully by next month. So I know a lot of you are doing mobile or you're hybrid. So the Google Map integration will allow you to plot all your patients and therapists on the Google Map, and you'll be able to see, geographically where patients are located, therapists are located, and things like that. It will be color coded, and you'll have filtering options, so it's going to be really cool. All right, so that's a little bit about schedule. The billing, so billing is pretty straightforward, same as 1.0. You go to claims, you go to ready to send, you have all your ready to send claims, you audit them, and then you submit them to the clearinghouse. Pretty simple. We're keeping that. So 2 enhancements I want to mention here to help you streamline. So if you're on ready to send and you notice, for example, let's say this, it's Anthem Blue Cross Blue Shield, and the therapist billed a CPT code that they're not going to pay for. So you can actually hit actions and you can click add event, and it's going to create an event. So this way you can tag the therapist and let them know, hey, give them your feedback, like Blue Cross Blue Shield is not paying for this code. You need to revise it or whatever the case is. And then you can, of course, put the note on hold. So this way it's not billed until the therapist resolves it. So I do recommend using this. Otherwise, things are pretty much the same. From the import perspective, when ERAs are coming back from the clearinghouse to HelloNote, we also, so I'll give you an example already posted. So one of the things we're doing, actually, we're showing you the ERA with the total billed amount, paid amount, patient responsibility. And then I can click on the arrow and it's going to break it down by all the, who the patient is, John Smith, for example, providers, everything that you need. And then you can actually go into the third layer, which tells me per CPT code. So I know exactly what was paid, how many units, and any adjustment codes, which is really nice. And of course, you can batch post it into HelloNote. And we do now have the option for automatic ERA import. So we're rolling it out to a few clients first, but we expect everyone's going to want this. So we're going to turn it on as a per request basis. So if you want us to pull the ERAs directly from the clearinghouse into HelloNote, we can do that. So no more needing to download anything, import. It's going to appear here for you as they come in. So speaking of billing, we can, of course, train you on how to do your own billing. If you are looking for a billing company, we do recommend Atelis. So Atelis is a billing company, and they focus a lot on AI, and they have a great staff and team members that can handle your billing. So I highly suggest reaching out to them, even if it's just for a quote to see what they can offer you. They do a free assessment of the health of your business, right, as far as billing goes, and they can give you feedback, and of course you can decide if you want to go with them or not. They also have a really cool scribe, so it sits on the browser, and you can actually speak your notes, And from there, it's going to translate all of that into the HelloNote fields, which is really nice. So definitely check them out. I'll go to a link afterwards so you can see where to request more information. So that was some billing. So again, going back to the left sidebar. So as far as the reports go, so we're adding a lot more reports. We're working on some really cool new reports. There's also a favorites. So if I click favorites, you'll see here, these are my favorites, because I know there's a ton of reports that we have. And I also know, not all of them you want to necessarily have in view all the time. So you can actually click on the heart bubble. So just for example, so if I go to billing insurance, you'll see here, the heart bubble is not filled out. So if I click on it, it's going to preload into my favorites. Okay. So that's a really cool enhancement here. As far as, reports go, all of the reports from 1.0 will be on 2.0 as well. So I know we're almost there with everything. And then new reports are always coming. And if you have a request for new reports, please let us know. I actually had a client we were talking with yesterday, and they mentioned a few enhancements that would be cool, along with maybe some custom reports. So we have no issue with creating custom reports for you, and just to make sure that you have the data that you need. So again, if you have a feature request, it could mean that others have the same request. They just either didn't mention it or they didn't even think of it. So again, we're very community driven. So give us your feedback, negative, positive, doesn't matter. We want to hear it so we can make our system better. So that was a little bit about reports. While I'm here already, so clock in, clock out. So here, if I clock out, for example, right, and then I regenerate the report, you'll notice here that it's going to appear. So I clocked in at 7:20, clocked out at 7:37, 16 minutes, 45 seconds. So yeah, this report I do highly recommend. Not only report, the feature I recommend you guys use. So let's see here. So next is the faxes. So I highly recommend making sure that you use the fax feature here. So I don't have any examples because this is a dummy office. But yeah, you can have incoming faxes directly integrated here. You preview the fax, let's say it's a signed plan of care, and then you upload it directly to the patient chart within the system. You don't have to download it. You just simply click a few buttons, select the patient, it uploads. And of course, outgoing faxes is part of the system as well, just a few clicks. So let's see here. So then going into settings, so we have autocomplete phrases. So you can set up different phrases. You can select and modify your CPT fee schedule and treatment codes. We have evaluation note templates that you can use to preload, flow sheets. So just want to show you, you can create as many flow sheets as you want, and then you select them right inside the note, and it preloads for you. So no need to remember which kind of exercise groups that you want and things like that. There is also an enhancement coming here where you can base it on a CPT code, and it's going to automatically link to that CPT code when you do billing. So it's going to preload all of these exercises. Of course, you could modify it as you need per note, but it's going to be there for you so you don't have to remember. So next, goals. Of course, you can add goals to your bank. There's inventory management. So if you wanted to add additional services or sell equipment within your clinic, you can do so. You can also apply a tax rate. So this way, when you print the receipt for the patient, it's going to add the tax rate. Insurance and payer ID. Just quickly want to mention this because when you press the action button, this is where you can preset the case rules. When I mentioned, when I did a demo of that, so you can select any profile that you want, any case type, place of service, all the rules here, and it's going to preload that when when you select the insurance. So that was a great suggestion. We actually had Melanie mention that to us. She does our demos and onboardings. So thank you, Melanie, for mentioning that. Let's see. We have PCP referral. Of course, you can store that. Referral request. So with 2.0, one of the enhancements here for referral request. So you can, of course, eFax a request for whatever service you want, but you can actually add all the bullet points that the provider can check off on. Okay, so self-care, therapeutic exercises, pretty much whatever you want, you can add here. And then when you eFax that referral request, they're going to have that as an option to check off. And then, of course, we have visit types. So visit types, you can add any visit type you want. You can assign any colors. You can also set default rates to your visits. You can change it per patient, but in 2.0, you can actually set default rates as well. Also packages, you can set up different packages and things like that. So yeah, that pretty much concludes just a lot of what I wanted to mention. There's no way within an hour I can go over every single feature. So that's why I want to have more webinars on a monthly basis just to go over new features. And of course, I want to hear from everyone what features you like, what can be improved, what features we don't have that you want. And just looking here, I know we have appointment reminders, but we're actually going to have so phone call is going to be coming soon, and also birthday reminders. So we're going to be adding a feature for emailing and texting your patients on their birthday. So they're going to get a little notification as a birthday reminder, which is really nice. All right, and so I know a lot of you, I know have established businesses, and a lot of you are just getting into the business. So if you know us, you know that we love to cater to the community of therapists. We want to make sure that things are flowing well, not only from an EMR perspective, but also for making sure that your business is successful. So we do work with Therapy Business Builder, and that's Kara Welke. She is an occupational therapist, a good friend of mine, and I've been working with her for a while, probably 6-7 years now, on making sure that therapists, if you're an employed therapist, that you know that there's option to also have your own business. So if that's something that's of interest to you, I have this link open here from Next Level. I'll put it into actually, when we send the recording to everyone, we're going to have this link on it as well. So I highly recommend reaching out. Also, if you are already you have an established business, Therapy Business Builder, you can still reach out to them and they help you grow your business as well. Because we have a lot of clients reaching out to us and they tell us, hey, I'm stuck where I can't grow anymore, right? So I have a successful practice, but I'm looking for the next phase of the business. Like, do I open up a new clinic? Do I open up a brick and mortar or do mobile? So that's that's not something you could just answer typically through an email. So it does require a call. So I do recommend Next Level's Therapy Business Builder for making sure that you either start or grow and build your practice. So going back to our HelloNote screen here, I think I went over everything that I wanted to. Again, there's not enough time to go over every feature and all the enhancements, but I do recommend if you're still on 1.0, reach out to us. Let us know you want to go to 2.0. We'll be happy to accommodate you. And I have to apologize because we have a lot of clients reaching out and say, hey, I've been asking to be on 2.0 for a few months. I'm still not on 2.0. So again, we have to listen to our engineering team. So we make as many accommodations as possible. So if you're not migrated yet, again, you're not forgotten. It just means that we couldn't kind of place your office into the migration for this month. So we'll do it for the next month. And we will reach out once it's ready because, again, it's very delicate. So we need to make sure that all the offices are aligned properly, and there's a lot that goes into it. So I just want to make sure that you're not forgotten, and I apologize if you reached out and you're still not on 2.0. We're doing our best to make sure that by hopefully around September, we get everyone over to 2.0. So the next thing I wanted to go over is the Q&A that we had. So there's about 40, a little under 40 questions that we had in our Q&A. So first question we had is, are you partnering with HippoScribe, and how is that working for members? So there's no official partnership. HippoScribe is an amazing scribe. So if you are using HippoScribe, it is compatible with HelloNote. We definitely, encourage you to check out a demo of any scribe, including Atellus has their own scribe. So there's a lot of scribes out there. So it's more of kind of demo it, try it out, and see if it fits your needs. Okay, because I know a lot of times it seems like they all do the same thing, but at the end of the day, there's a lot more that goes into that. So definitely do a demo. And how is it working for members? I've heard amazing feedback. So I've seen demos. So you can definitely check out some YouTube videos. And yeah, it works great. It does exactly what it's supposed to do. And that's what you expect from a scribe. So can we use HelloNote 2.0 by phone to document? Yes. So HelloNote 2.0, one of the reasons we went to 2.0 is for scalability. So when HelloNote first was a thought, nobody was using phones or tablets or even laptops to document, right? Everything was on kind of PCs or Macs, just desktops. So as technology improved, devices got smaller, and we had to trend with the times. So yes, 2.0 is a lot more responsive. So that means you can use it on the phone. We have a ton of users using Chromebooks and iPads and Android tablets. So it definitely works on that. Also for phone. So again, you got to remember screen size. So do you want to have the full effect of the whole EMR on a phone? It's going to be difficult because, screen real estate is important, right? So if you want to use the phone to document, you can. But keep in mind, I recommend like a daily note to document, not a whole evaluation. Can you do a whole evaluation on the phone? Yes, I've done it. I've done daily notes and research, things like that. So yes, you can use 2.0 to document. Also keep in mind your phone and browsers have an option for dictation. So you can use that as well. And then you just speak and it goes into the field of where you are in HelloNote. The next question is, how soon until the calendar can be more easily synced with Google Calendar? So great question. We've been working on that for quite a while. It's not an easy task to do because, again, we have to maintain HIPAA compliance. And, when you have multiple therapists, we need to make sure it properly syncs. So it is getting worked on. Right now, you can download from the schedule. So let me just see if it's available here to show you. So right here, if you notice, there's an icon on the right called Download ICS Calendar Sync. So if you download this on your phone, it will sync your calendar to Google or to Apple, whatever you need. Okay, so what we are working on is a way to just do an automatic integration. So it'll just be much more streamlined. How soon until automated phone call appointment confirmations can be made? Surprisingly, it's not, we don't have too much feedback from clients on wanting this. So and again, if you want this, don't be shy to reach out to us, because the more users that reach out about a specific feature, the more we know that we have to prioritize it. So right now, the expectation is, I think by September it should be live, the last time I checked. But if you want it sooner, please, if this is something important to you for phone call reminders, let us know and we can bump up that time. How to streamline intake, patient self-schedule, patient portal, sending intake consent forms, patient reminders, insurance verification. So great question. So I just want to go back to the Patients tab. Oh, actually, I wanted to showcase one more feature. I apologize. I didn't showcase it earlier. So when you put your mouse over the patient name here, you do have action buttons on the bottom, right? So we added some new action buttons, but one of the ones we actually get really cool feedback on is this new note option. So if I click on it, it's going to actually ask you, which note you want to create. So in this case, I can't open a new note because the prior one's in draft, but if all the notes are done, you can actually initiate a note right from the schedule. So we've been getting a lot of positive feedback on that. So thank you, everyone, for using it and suggesting it. As far as streamlining intake and all of that, so I actually have a client. She allowed me to use her website to showcase this. So this is her website. This is Amy from Custom Care Rehab. So thank you, Amy, for allowing me to showcase it. So in her website, we actually embedded the calendar. So patients can go to her website, let's say it's late at night, they're looking for a physical therapist. They come here, they select the visit type, let's say PT evaluation, and then they can see all the available times. Anything that says booked, of course, with HIPAA compliance, we're not going to show any patient information, but we're showing that it's booked. They can book those times, including static events. So if you have like a static event, non-patient event, it's not going to allow the patient to book. Otherwise, they can click on an open field, and now they can put in their first name, last name, date of birth, phone number, email, and any comments. So what will happen here, once you press submit, it's going to send them an email confirmation to the patient. It's going to send you or the office a notification that a patient is trying to book an appointment. And on the schedule, you'll be able to approve or deny the appointment, which is really nice. And to streamline everything, it's going to automatically register this patient to the portal. So it's going to send them an email to, with their portal login details and send them a link to the intake consent forms without you even having to do anything. So that means if they, let's say late at night, they're looking for a therapist, they find you, they fill out this form, they're going to get the option to fill out intake consent forms. So by the morning, when you're in your office, you're going to get a notification that you have a new patient, and you're going to see, oh, they filled out intake consent forms, insurance is great, everything looks good. And then you click the approve button and it emails them, okay, your appointment is confirmed, which is awesome, which is amazing as far as streamlining goes. So if you want this feature enabled, just send us an email because it's specific to your website. So you cannot use somebody else's calendar, of course, on your website. So we give you a specific link to use to put on your website. So highly recommended, and this feature is only going to get better because I know we have a lot of clients that are piloting it, and and streamlining things is on top of everyone's list. So I'm sure we're going to get a lot of cool feedback so we can implement it. Also, there is an option for waitlist. So let's say there's a booked appointment, so the patient can add themselves to the waitlist. They can choose the date that they want and the time, and it's going to allow them to schedule. But again, it's going to email you and make sure that you reach out to the patient for that. As far as eligibility goes, so going to the patient here, in the insurance tab, there is a check mark to the right of the insurance where you can check eligibility. Okay, so again, highly recommend signing up to this feature because it's going to give you information from the insurance portal of if there's any, let's say, co-payment or deductible. If it's Medicare, it's going to tell you if it's traditional Medicare or Part C, which is Medicare Advantage, the KX modifier threshold, home health. So I don't know how I don't know how some clients actually don't sign up to it, especially if you bill Medicare, because this is just such a huge time saver, and it gets bundled to your billing tier. So you're not really paying. There is a one-time setup fee, $25 right now. The vendor collects it. It's not something we collect. We pass it along. But other than that, there's really no cost unless you use it. So if you don't use it, you don't really have to pay for it. But so I don't know why more clients are not signing up for it. Maybe you don't know about it, but I highly recommend it. All right, so next question. Is there a payment plan type billing available or automatic monthly billing available for subscription services? So, so I'm assuming this has something to do with packages. So we do have packages that you can set up in HelloNote. As far as automatic monthly billing, haven't had any feedback on that before, but I'll take note of that, and I will reach out to whoever requested this question to get more information, and we can always add this. Next question is, need a seamless monthly report that includes therapist name, license number, client name, ICD-9 code. So it's mentioning ICD-9, but ICD-9 is phased out a long time ago. So ICD-10 is the current diagnosis codes, NPI, CPT codes built. So it pretty much looks like this question wants like a custom report. And then they're mentioning everything needed in a super bill in a simple report. So we do have the option to print out super bills. So if you go to visits and receipts, right? So I can pick a random example, print, super bill, and then it's going to generate you the super bill, including everything you need, including the group NPI, tax ID, CPT codes, modifiers. So we have a lot of clients that use this super bill. They provide it to the patient or to the insurance. It has everything you need. If you're looking for like a more custom report, let us know and we'll be happy to build it out. So next question, not sure if this will be the right place to ask, but here are my questions. When is Patient Portal going to be operating and live? It's already live. Can we update pediatric evaluation forms? Will it be possible to expand forms to include feeding evaluations? So it looks like a lot of these questions are more like custom notes. So, we are excited to announce that we are working on custom notes, which is something we actually couldn't do in HelloNote 1.0, but we're excited to do it in 2.0. So yes, you will have the option to create your own note templates. And the reason we're doing that is because we had so many clients. And again, documentation is not one size fits all. Yes, we have great templates, Medicare compliant templates, pediatric templates, basic templates for like for wellness and cash-based, but every therapist has their own needs, right? Especially when it comes to specialties, maybe like lymphedema, home mods. So we've been getting a lot of requests early on for custom templates, which we built out, but it's really expensive to do and it's very time consuming. So for 2.0, we're gonna take care of both of those by allowing therapists to create their own templates, which essentially means you'll have a designer, note designer, and you'll be able to add whatever you want to add to it. So that's going to be a really cool feature to look forward to. Realistically, this is probably going to be out maybe October, November, but it is something we are working on. Next question is, so just curious what the difference is between 1.0, 2.0. So we went over that. Let's see. Next one is there a better integrated fax process? Faxage is partially integrated, or will it be possible to have features like automatically fax the POC when the clinician finalizes the note? So yeah, actually we have that feature almost launched. I don't know if it was you or somebody else that mentioned this feature, but we actually are very close to releasing a feature where once you finalize the note, it's going to ask you if you want to fax the plan of care. With that being said, we have to be careful. So even though it seems like a simple feature, there are going to be a ton of clients that don't want this feature because maybe you have a supervisor that reviews your notes, right? And if you send it before somebody checked it, then that's a problem. So it's going to be a setting based, but yes, we are going to be releasing that shortly. Let's see. So someone has a Suggestion, wish I could make adjustments to date time of the visits on receipts and visits tab rather than having to load the calendar. So yes, we actually are going to be updating visits and receipts, so you can change the date and time directly from here. So let's see. I think there's multiple questions on this one. There's also a feature coming where once you do your notes, it's going to automatically update the visit type on that. So that is also something we are working on. Okay, so next question is, what is the process to get a template built? So I think this question is related to custom note templates. So right now, we are no longer accepting custom note requests because we are working on the ability to have therapists do their own building of their own templates. So, okay, next is when trying notes in comments box next to CPT codes, if you scroll too far down, it kicks you out of typing and you have to go back in. So I'm not sure if this is on 1.0 or 2.0. So we'll review this with the person who asked this question. Next question, when will we be migrated to the 2.0 version? So again, we will migrate you either by your request, so we'll put you to the next available spot, or by September, you're going to get an email and we're going to put you into a date spot for you to be migrated. Will 2.0 allow one therapist to have a note pending and allow another therapist to create a note on the same client? Will 2.0 allow one therapist to have a note pending and allow another therapist to create a note? So I think you're asking if you're allowed to have two notes with another therapist open at the same time, like draft notes. So there is a setting to enable that. It's called disable carryover in the case settings. We don't recommend it because it's going to break the flow of pulling in the notes. Because once you have more than one draft open, right? The next time you open a note, we don't know where to pick the data from the last note, because we can't assume that the draft note is not going to be changed. So there is a feature for that. We don't recommend using it, but you can enable that in the case settings. Let's see. So will 2.0 correctly order the visit count by data service and therefore pull most recent documentation forward? Yes, it does that already. But if you're out of order with your documentation, meaning that let's say you forgot to do a note and you're backdating it, so you can actually go into, let me show you here, just as an example. So you can actually go to note options, go to batch print, and here you can actually drag up and down where you want this note. So it's going to reorder it for you and recalculate the sequence to update it. Okay, so that is an option. So next, will billing be affected? Will my quota be able to schedule appointments with clients? No, HelloNote 2.0, the billing is the same, and your quota, yes, will be able to schedule appointments with your clients, just like they are in 1.0. So another question is someone's asking also about generating new notes before the prior note is not closed. So again, so we're going to reach out to whoever requested this, but there is a way to enable that. We don't recommend it because we don't know which data to pull forward from. And also, just by managing practices and as a therapist myself, it is really important for me to make sure that I finish all my notes on time, right? And one of the reasons that I get pushed for that is I know I cannot start a new note until the prior one is finished. So it actually forces me to make sure that my notes are done on time. And I speak to a lot of therapists, and they're actually thankful for that feature because it makes them do notes on time. And then administrators are thankful for that because it makes sure that therapists are not late with notes. So yes, there is a setting to disable that if you really want to do that. And this setting has to be disabled by an administrator. It cannot be disabled by a therapist unless you have permissions for that. Next question. I would like to know your HelloNote 2.0 has talk to text option. So we actually have a phone number. So if I go to the patient information tab, so one of the first action buttons, or the first action button, is called dictation service. If you click on that, it's going to open up on your phone as a dialer, and you can leave the detailed message on the patient ID and the note, and we'll transcribe it for you. As far as talk to text, so yes, your browser has talk to text functionality along with your phone. So it's not something that we had to build out because it's already something that exists on pretty much all browsers and phones. Can we use HelloNote 2.0 by phone to document? So that's somebody else had that question. So the answer is yes. Another question, can you lessen the number of clicks? Too many causes my fingers to fatigue and pain with clicking my mouse. Yeah, I mean, we do our best to make sure that you don't have to click as much. But if there's specific areas that you want less clicks on, let us know specifically where those are, and we'll take care of it. We'll do our best to make sure that you don't have to click as much. If you're referring to notes, they have the default template, which does have more clicking, which some therapists love. And then we have the basic profile, which is more narrative based, so you don't have to click a lot. Also, the Tugberg and some other tests do not show any interpretation like the Tenetti. So for interpretation, if you notice we don't have an interpretation, just let us know which test. So in this case, we're going to look at the Tug and the Berg and the 5-time standing test. So we'll look up the interpretation, but we need to ensure that it's the official interpretation. Okay, we can't just take one from Google or anything like that. We have to make sure that it's official because these tests, a lot of them are copyrighted. So we have to make sure that they're correctly interpreted. All right, next one. I need to know how to download the remits from Inovalon, which software to use as they are encrypted. I use an HP Chromebook and my remits are Inovalon. If I download right now, I cannot upload them in an encrypted form. So it sounds like you're trying to download the file and open it. So there's two solutions here. One is download the file and import it directly into HelloNote. You don't have to open it because we unencrypt it. And then the other option in HelloNote 2.0 is we can enable the automatic ERA importing. So you actually don't even have to download it. It can automatically import. How to get paid if the secondary is Medicare? So we have tutorials on that. So reach out to us and then we can send you a guide on how to do secondary billing. Integration with HippoScribe and checking eligibility. So I did go over that question earlier. Someone else is saying, they hope the migration is easy, not a fan of change. So yeah, we hope so too. There was a lot of thought process on how to make sure the migration is easy. Believe me, it's a lot harder on our end than it is on our users because we have to deal with the technical side. As far as the migration itself, I mean, it's very easy on your end because you don't have to do anything. Once you're migrated, you just log in as you normally would, just with a different link, and all the data is going to be migrated over. As far as not being a fan of change, so unfortunately, we had to make sure that our user interface was improved, and that's why we made sure that a lot of the buttons and functionality remained very similar. So no one gave us feedback thus far that they were lost or anything like that. It was, it's pretty much straightforward. Next, will the payment system be eventually integrated so that once a copay or payment is made, it automatically shows in the payment system? So yes, we are working on a better a more streamlined integration with the credit card processing. So this way we'll automatically apply the copayment if needed. And will the administrators have access to the user section so they can add and remove users without having to go through HelloNote support? Great question. Absolutely. So we are currently working on integrating our invoice platform into HelloNote. So what that means is that you don't have to go through us to add users, remove users, or make changes to your account. You can also see all your invoices in one area. So that is being worked on. I hope by September we'll be live with that, but it is something I personally was looking forward to for years. And now we're actually at a point where we can bring that to life. So next, someone had 3 questions here. So would there be a way to have a report of active patients for each insurance without having to go to an Excel spreadsheet? Yeah, we do have reports with patients and insurances. One of the reports that I can think of is the active patients. And then you mentioned without having to go to an Excel spreadsheet. So you can filter it out right on the system. But if you need to export it, then that's fine. If there's a specific report that you want, please reach out to us and we'll make it happen. Next question, is there a way to have the system queue a few days or a few visits before an authorization is up? Currently, when I put in the authorization, I usually put a few visits less than it really is, so we get queued. Yes, so if you're using the calendar, it will. There's going to be an icon to show you that there's, I think 2 visits before expiration. Also, you can use the events. So going back to, on the bottom here where the events are, you can also set up a reminder there. But I understand what you're saying, and I think it's a great addition, enhancement. So I'll make a note of that, and we'll ask our engineers to put a flag to let you know that authorization is coming up when you document. And then third question, thank you for your efforts and always trying to improve the efficiency. So thank you for that comment. It means a lot. Next question, updates on generating therapist invoice report in batches as opposed to one by one. So actually we had an update about a week ago to allow you to select multiple therapists. I think that is probably what you're referring to. So we have that now. And updates on having access to switch users from active to inactive. So somebody else also asked about that. So yes, it is coming. I think around September we should be live with that. So no more needing to reach out to us to add or remove users. Updates on expanded label options for the Documents tab. So for this one, so if I go to the Documents tab and I upload, so you're referring to here to add more options. So yes, so we are working on an option called a document type manager, where you can add whichever options you want in here. As of currently, we've just been getting feedback, and based on the feedback, we added it. But yes, I agree with you. I think it would be nice to have the option to add your own, because every client is different, so we want to make sure that we can cater to everyone's needs. And then updates to having an app for improved phone and tablet use. So an app is going to be coming. We do want to make sure that we migrate everyone first before we start working on a new app. But just so you know, it's already in the works. And that's also going to come with a kiosk feature, which is going to be really cool. So if you have like a brick and mortar practice, we'll have a kiosk mode where patients can go in and check themselves in, print their balances, pay their bills, fill out forms, whatever you need from that perspective. Next, is there a way you guys will be updating the schedule display? With multiple therapists, the days all blend together. For instance, Monday, Wednesday, Friday would be a gray background. Tuesday, Thursday would be white. So we actually have an update coming to allow custom view on the schedule. So right now, if I go to the schedule, we have the option for day, work week, month, agenda. So one of the new updates will actually have custom view. So if you only want to see Monday, Friday, or whatever the case is, you can do that. So yes, so that is going to be coming. Also, additionally, pinning the therapist names to the top of the screen, even when you scroll down, so you can tell who you're scheduling on. So what you're referring is sticky headers. So we actually tried releasing that feature maybe around 4 or 5 months ago, where as you scroll down, the first 2 rows stayed with you. But unfortunately, that update did not go as planned because it actually messed up the view. So we had to revert that update and go back to the drawing board. So the good news is that, yes, it is coming because it's a feature that we plan to release. We just couldn't make it work. The bad news is that it's currently not available. So I'll make a note of that, and we can prioritize that as well. So next, is there a correct format to follow when naming files and uploading documents? There has been instances where a file has been uploaded, it has a date attached to the name, and the system simplifies it to a number. So for this one, again, I think this might be an issue on 1.0, where it can reformat it based on different characters. But to answer that question, as far as naming, we don't really, have a preference of how you name your documents. The only thing I recommend is just stay away from like special characters, because sometimes browsers can interpret that and not upload properly. So otherwise, there shouldn't be any issues. If you have a specific issue on that, you can always reach out to us and give us an example, and we'll handle it as a support inquiry. Is there a way to print patient visits chronologically? Can we see patient age easily while writing assessment on an evaluation? So first question, printing patient visits chronologically. So yes, you can use a report. For example, if I go to the schedule, I can go to the visits report here. So I can actually print in different orders based on the columns. We also have schedule statistics report where you can use that. So you can print however you need. Let's see here if there's another. From visits and receipts, you can print however you need. But if there's a specific report that you want it printed on, let us know and we'll make sure that option is there. As far as seeing the patient's age while writing an assessment, this is already coming because we have it in 1.0. We just didn't bring it to 2.0 yet, but it is coming. So hopefully in the coming weeks, actually, we'll have that option. So you see the patient's age right next to their date of birth. And can we open a note before the previous one has been finalized? So I mentioned that before. There is a way to do that. It requires you to uncheck or actually check a setting called disable carryover in the note settings, and that's gonna allow you to open up multiple notes without finishing the prior one. Just be careful with that, because then the carrying over of data will not work because we don't know which data to take from. Next question, I would like to learn about the upcoming free version. So yeah, we are planning to have something called the free MR. So it's going to be a free version of HelloNote. So we didn't finalize the details yet on it because, again, we're making sure that the migration is done before we launch any new kind of packages or platforms or versions. Right now, we do have HelloNote Lite. So if you're just looking for a basic EMR with a lot of features already in there, like scheduling and printing things and some basic reports and just documentation, so HelloNote Lite can be for you, okay? Especially if you're like cash-based and you don't see a lot of patients, you can look into that. As far as the free version, we are working on details on that, and once we have that, we'll send an email newsletter on that. Next, how can I incorporate it in the home health PT patients? So if you're doing home health and you're billing Part A, we do have, so just to show you, when you add a case, in the case type, there is an option for Medicare Part A. So we actually have a lot of clients that use HelloNote for Part A documentation for home health. So if you want to use it for home health, we have a specific template for it, so you can use it. But make sure you reach out to us. We can show you a demo of how that works, and make sure that your agency is okay with it. Because I know, we do work with a lot of agencies that use HelloNote for Part A documentation, and then we have a lot of clients that subcontract with Part A agencies, and they use the Part A template and send the notes to the agency. So it's been working really well. I have not heard of any issues. We actually did some enhancements recently, as requested on Part A notes, but you can definitely use it. Please show how to create custom templates and options for adding individual muscle testing and objective measures. So that is going to be coming, as I mentioned before, to allow everyone to create custom templates. Once it's ready, most likely we'll have a whole webinar on how to create it. So this way everyone knows the functionality of it. How do I add, remove therapists, and how do I assign practice patients to them? So as far as adding, removing therapists, just reach out to us. As always, you can call us, you can email us, or on the bottom left, there's a help button. There's also a new area called select topic. So if you have account management questions to add users, you can select that. And please try to use this select topic because it helps us route your question to the appropriate team member. Again, our team members work really hard to make sure they answer your inquiries as soon as possible. So if you don't tag it properly, maybe it's going to go to a team member that has to re-tag it to somebody else. So please try to do your best to tag properly. As far as the next question, assigning practice patients. So there's two options. One, you can of course add a test patient to HelloNote. And then when you go to the notes, you can press add, create a case, and then where it says assign therapist, you're going to assign your therapist to practice patient. Also, remember, you can also go into the user settings and enable my patients only, which means that the therapist will only see patients assigned to them. So if you don't want your therapist to have access to all your patients, then you can enable that for them, and they'll only see patients assigned to them. The other option is a sandbox account. Typically, it's not needed. We had a few clients request it, and we created it for them, which is no problem. But then when we review it with them, they don't really even use it. So there's no point to have an extra location under your, under your name, because it's going to clutter up your reports maybe by having multiple. So there's really no need for that. You can use like a fake patient, but if you want a sandbox, reach out. We have no problem with creating it. And next, what marketing tools are available and integrate with our website built on WordPress? So as far as marketing tools, we actually have a upcoming update. We have this on HelloNote 1.0, and we're bringing it back to 2.0, or we're bringing it to 2.0, but enhanced, which means you'll be able to like eFax, email, and SMS blast either your patients, your providers, or your internal team members for any announcements, or maybe special offers or vacation messages like holidays. So you'll be able to do that. And then the other question is, can we use your forms to collect forms electronically from our clients? So yes, you can. That's our intake consent forms. You can use that now, or you can wait a little bit, and we'll have the custom intake consent form feature available as well. So that is the questions that we got as far as our live Q&A goes. So we appreciate the questions that you guys have. If you have other questions, actually we have some questions that users asked during the webinar side. I do want to go over them just in case. So we have somebody that asked, I need to send the fax to my Mac. Can I do that within HelloNote? Yeah, you can. I tried to play around with settings, but it looks like I can only send an evaluation to an MD. So yes, the reason you can only send it to an MD is because in the PCP settings, you just have to designate the provider status. So you can add your Mac in there. Just make sure you hit that provider checkbox, and you can put non-applicable there, and it's going to let you send it off to your Mac. All right. So next question is Atellus working with smaller scale businesses now as well? So I know they're doing their best to make sure they accommodate all clients. I can't speak on their behalf because they have to evaluate your business to make sure it's a good fit. But definitely reach out to them and see if your business is someone they can take care of. Next, might you be willing to create a report calculating total units? So we have that report actually already. So if you go to billing, transaction, and this is one of the reports that has it. I know there's multiple. So in the transaction report, one of the columns is, let's see, right here, total units. So as long as this is checked, you can use this report and it will say it. I also know that therapist invoice report has total units as well. Next question, will there be an app? So yes, an app will definitely be coming. We're just really trying to migrate all of our users before we launch any new platforms. But yes, an app is on our engineering team's list. Next question. So it is very difficult to see more than one therapist schedule at the same time. Is this going to change with 2.0? Yeah, with 2.0, you should be able to see it a lot more clearly. Also, as you add more therapists here, and I do get it, once you have once you're in week view, for example, or work week, and you have 5 therapists, of course, the screen is going to start to get narrower. So what we're actually doing, or we did actually, is we're going to initialing the therapist name. So this way it fits a lot nicer. Next question, under a certain patient, will we be able to see their scheduled appointments? Yeah, absolutely. So when you go to patients, just make sure that you go to the visits and receipts tab. So here, let me showcase that. And it's going to show you all the patient's visits. So make sure that you do that. Next question, can you please show us the patient portal? So I don't have access right now to show the patient portal on my account, but you can always reach out to us and we'll show you how to use it, or we can do a separate webinar specifically on patient portal. Next question, can you tell me which text boxes are we able to use the autocomplete in, as it is not available in all boxes? So it should be available in all boxes as long as they're text fields. If they're not a text field and they're part of a grid, possibly it's not available, but majority of boxes should definitely be available. If you have a specific box that you want the autocomplete on, let us know and we can always add it. So next question, sometimes I add a progress note when I mean to add a resert. Can you change it so that that if you add a progress note, you can switch? So I've heard of this request a handful of times. It is on our engineering list. So it is going to be worked on, so you can toggle between progress note and resert. For example, let's say you opened the progress note accidentally. You don't want to redo the note. I definitely get it. So there is actually a feature coming for that. Next question, will the webinar be available to rewatch? Absolutely. This is recorded, so we'll be uploading it and then sending everyone a recording if you even if you're here, you want to rewatch it, or you didn't get a chance to watch it live. And the last question, will the schedule be fixed for daylight savings time in November when the time changes again? Yes, so with 2.0, the schedule is completely revamped. So we want to ensure that daylight savings time, anything like that is not affected like it was in 1.0, where I know for some users, you had to wait until daylight savings time for the schedule to update. For 2.0, we're going to be proactive, and we're going to make sure that that's not an issue. All right. So yeah, awesome. This was great. I always love feedback, hearing any questions that you guys have. If you're not a HelloNote client and you want to schedule a demo, please go to HelloNote.com, click the schedule demo button. We'll be happy to show you a demo. There's no charge for it, so you'll have a live demo on that. And if you are a HelloNote client, we greatly appreciate you as clients. We wouldn't be here without you. So please keep the feedback coming. 2.0 is almost fully migrated, so we can finally launch a lot of new cool features that we have anticipated for quite a while. Otherwise, yeah, we'll be working hard to make sure we accommodate all your needs, and we look forward to growing with you. So thank you, everyone. Appreciate it, and looking forward to the next webinar. Thank you, everyone.